Good evening, I'm Mark Kiesling.
And I'm Julie Williams. The pandemic has been hard on Illinois' rural fire departments.
And as News 3's JC Brienne shows us, several of those departments will soon get some much needed financial help.
8 Southern Illinois fire departments are being recognized after facing trying times brought on by the pandemic.
We reviewed what was happening during the COVID pandemic and how these rural smaller departments were losing money because they couldn't do their social events, the pancake breakfast, spaghetti dinners, those kind of things.
The Illinois Fire Department COVID-19 relief grant awarded more than $316,000 to a total of 36 departments across the state.
We know that they operate on a tight budget to begin with pre-COVID. So with the restrictions that were created by the COVID pandemic, we wanted to make sure that there was some way we could help them kind of make up those lost funds.
Eligible fire departments were able to receive up to $15,000 to help with the ongoing costs.
We've done a fish fry. It's been going on for I don't know how many years, probably 70, 80 years. It was an annual Good Friday fish fry that we wasn't able to have last year. So we've got the opportunity to apply for the grant.
It's very hard for our rural area, the town we are in. We have a population of 350 people, not counting the rural area we support, but there's no funding. We are a very limited budget, and tires aren't cheap and new equipment isn't cheap.
Fire officials say the money used for fuel, utilities, and insurance is vital to keeping departments going.
70% of the Illinois Fire Service is rural and volunteer. So when I found out how hard they had it, how hard they worked, and a lot of times they're not even getting paid, my heart went out. I just wanted to do everything I could to help them and get them the resources they needed.
In Pinckneyville, JC Brienne, News 3.
Well, the main goal of the Illinois Fire Prevention Fund is to help departments keep the lights on so they can help keep people safe.